My topic was about, my research was a review of literature on the impact of abortion stigma among people of color in the United States. I was mentored by Dr. Anvita Dixit from the University of Ottawa. First, I will go into my introduction, then I will go into the methods and results of my research paper. I will also go into the conclusion of my research paper, and we'll talk about the mentor and experience. Why did I choose this project? What is it about? I chose abort. So let's first define some terms first. So abortion is a procedure to end pregnancy. It uses medicine or surgery to remove the embryo or fetus and placenta from the uterus. The procedure is done by a licensed healthcare professional. Stigma is an attribute that conveys devalued stereotypes. At a micro level, stigma restricts the well-being of stigmatized individuals. At a macro level, stigma reproduces social inequality through the maintenance of group hierarchies. So abortion stigma is the set of attitudes and beliefs, conscious or unconscious, that abortion is bad, shameful, or wrong. This means that the stigma of abortion manifests within multiple levels, including media, law, and policy, institutions, communities, relationships, and individuals. Therefore, abortion stigma is experienced through negative attitudes, and behaviors related to abortion, inferior status experienced by a woman who seek abortions or have abortions, abortion providers, and others involved in abortion care. Abortion stigma is a barrier to care. Abortion stigma leads to the social, medical, and legal marginalization of abortion care around the world, and is a barrier to access high-quality, safe abortion care. It also has psychological effects as well. Available research is in agreement that abortion does not lead to long-term. However, there is a strong and significant association between abortion-related stigma and pre-abortion depressive anxiety and stress. So what is abortion stigma's impact on people of color? Historical injustices include forced sterilization among mostly low-income people and people of color, and current societal practices, including preferentially encouraging long-acting reversible acts of contraception among communities of color and low-income people, are just two examples of policies and practices that exemplify how reproduction is stratified in the United States, with devaluation of the fertility and parenthood of African American and Black people. In the context of abortion, white people who have an abortion may experience stigma for not conforming to these societal ideas of place, while African American Black people, as well as Hispanic people, may perceive less stigma from society that value it. So my primary research, my primary research question was, in what manner does the stigma against abortion impact people of color who have an abortion in the United States? So let's go on to the methods and results. How was the study carried out? So first, we wanted to go over the inclusion criteria. In order to find sources of evidence that met the criteria of this paper's claim, we have statistical evidence of people of color with their association of abortion stigma. That means people of color must be and must have statistical results regarding each race in the study. So that means having those that are of this objective. The studies that were included in this must have also been located in the United States. The elements must have had an experimental study of those studies. It must have been published in the last 5 years and must have study design variability, which means that the paper has to have a qualitative or quantitative design so that the content remained relevant to the time. I moved on to the search strategy, which means that for the database is used, including PubMed and Google Scholar, there were significant terms relating to abortion stigma to find these papers. Such include abortion stigma and attitudes towards abortion, in addition to race and ethnicity specific terms such as people of color, African American, Asian, Hispanic, and Latino. Hence, all data was charted on a Google Sheets table, and each column on that table referred to a different part of each paper. So that means name of article, location, study design, and ample key findings and recommendations. On to the data extraction. So all variables for which data was sought includes the race of the abortion patient and their experience with abortion stigma. Therefore, handling and summarizing the data that was charted were to obtain the relevance of each, all were related to abortion stigma, and to pull out key findings that related to abortion and stigma and race. And then we move on to the data analysis, in which we conducted a what types of articles were found, and then carried out a qualitative, thematic, and narrative synthesis. I'm going to move on to the results. In the quantitative studies, we found that in the Talaria Institute's 2008 abortion patient survey dataset, 9 specific questions about abortion stigma. Results demonstrated that there is an overall significant mean difference in the perception of stigma between Hispanic women and non-Hispanic women. And specifically, Hispanic women perceive significantly more than abortion-related stigma when compared to both Black women and women who identify their ID. Among those with high perceived abortion stigma, Hispanic Latino people were less likely to report psychological distress than non-Hispanic white women. African American or Black women were less likely to report perceived abortion stigma compared to non-Hispanic white people. However, there is a high community level stigma with Black people compared to white people in another study. And when interviewed in a qualitative study, a Catholic Hispanic and Black non-Hispanic Protestants stated that they specifically feared religiously based condemnation if they had abortions, while an Asian with no religious affiliation classified the distress as stemming from a moral conflict. Such accounts are listed below. As you can see, there are just so many negative connotations associated with the abortion, as well as the interesting correlation with religion, which I never really expected to find in these results. So now let's move on to the conclusion, which includes our results, implications for future study, and limitations and challenges of the study that I conducted. Results. There is an overall significant mean difference in the perception of stigma between Hispanic women and non-Hispanic women. Hispanic women and Black women receive significantly more abortion-related stigma when compared to women who identify their ethnicity as other. There was also a really big correlation between people of color and their religious affiliations, as well as how much abortion stigma they perceived and how that related to each other. So implications in the larger U.S. context for further study. So these findings can inform reproductive health providers which populations will benefit most from pre-abortion interventions or resources for decreased stigmatization. In order to better protect these marginalized groups from negative impact of stigma. We can also conduct further research to better understand the stigma surrounding abortion care services in order to work towards decreasing the stigma associated with terminating a pregnancy. Identifying certain groups who have a higher propensity to experience stigma surrounding their abortion may help to better predict which women will experience post-abortion negative outcomes. Negative emotional outcomes, as well as know which populations will benefit most from pre-abortion interventions or resources to prevent or attenuate stigmatization. It may be of some benefit for these providers to have knowledge of populations who are more prone to experience stigma so they can more proactively assist with interventions to combat potential negative emotional reactions due to abortion-related stigma. So some limitations and strengths in the study. Limitations were that for the study were that there was broader, less defined research. So we could have gone way more into it, such as I said before, going more into the correlation between religious affiliation and abortion stigma and how it increased and decreased with how they were like. And then there was less inclusivity in these studies. So a lot of these studies that I went into and only discussed women, and which is not inclusive to the United States population. So in the future, I would like to go more into depth about how this issue affects everyone. Some strengths of the study include that there were various types of literature used. So there was a good balance between quantitative literature and qualitative literature, and all papers had a good sample size. So now let's move on to the mentor and experience. It was amazing, this mentorship. I am so immensely grateful that I was able to work with Dr. Enrica Dixit for this project. It has truly been such an enlightening experience, and her words of advice and motivation have really inspired me to pursue my passion in the research field. As my mentor and I are people of color, this study made me incredibly aware of what is going on in the world in regards to our reproductive rights and mental health. So I hope to become a researcher in reproductive health and rights one day due to this mentorship. I'm so thankful for Ms. Dixit's endless encouragement and offering of expertise as they will stay with me. Thank you so much for listening to me, and I hope